Okay, we're going to start. Oh. Yeah. Okay, we'll start. Thank you all for coming. My name is Dermot O'Donovan. I work here in NUIG in the School of Medicine, and I'm the Director of Public Health in HSE West. And I'm part of the Irish Forum for Global Health. So it's a pleasure to welcome you all. Just a few things to start with. You can see where the fire exits are. Can people turn off their phones or put them on silent? We're aiming to have lunch at 1 o'clock, hopefully even starting a little bit before, because we have to move in the afternoon across the road to the Westwood Hotel. So we're going to have a 3-minute walk in the middle of the day. The Irish Forum for Global Health is the main host of this meeting. So the forum started 12 years ago as a network of people interested in study, research, practice and action around issues that prioritise improving health and improving advocacy for health for people in all parts of the world. So from global to local, but with a concentration on issues that transcend national boundaries. So it's not international health, it's global health. So the idea of the forum events is to bring people together, to connect people with common interests, and to look and see ways that we can see how we can raise awareness about issues that are of global importance. So today's issue is climate change and health, and the person who's driving this is Niall Roach from the Forum, who will introduce the conference. Thank you.
Thanks very much, Dermot. My name is Niall Roach. I'm, like Dermot, a member of the Irish Forum for Global Health. We're a network, I think, of somewhere around 700 people who are interested in global health. Some of us are health professionals, some are not health professionals, but we all have kind of a passion for global health. And I suppose within the Forum for Global Health, we had a meeting on the board there back in, I think, February or March, and we felt that this was an issue that we should be raising. And part of the objective, I suppose, of today is, as Dermot said, what the Irish Forum for Global Health wants to do is to ensure that we at least communicate or share some knowledge about the topic of climate change and health. Maybe in Ireland we tend to talk about climate change with respect to food security and land use, but what about the effects on the human population? And the other thing too is to bring people together. We were at an event last night called Convergence. I suppose we want to converge or bring people together and to connect and to network and to share ideas and to work together on the entire issue. I suppose I have many thank yous to mention. This is not just an Irish Forum for Global Health. There are many different partners who have been involved in organising this and also in funding us. The Ryan Institute, who you can see over here, have been heavily involved in it. We have Trocra, who specifically funded us. The Development Studies Association of Ireland have also funded us. And we've had involvement with a number of other institutions. Let me just see if I can find their names. The Ryan Institute, Trocra, DSAI, the HSE, Cultivate, the Galway City Community Network, and the Irish Forum for International Agricultural Development. Okay, so many people have been involved in this. In terms of the context, I suppose, as we said, today's focus is both global and local. We also want to talk about the threats that climate change poses to health, but not all doom and gloom. We also want to talk about the opportunities. There are huge opportunities for us as a global population in terms of what we can do in terms of protecting and promoting health. I don't want to speak for too long. We have a packed programme. As you can see maybe from the programme, we have 4 speakers this morning, each coming from a diverse number of backgrounds. A couple are coming a long way, from as far afield as Australia, maybe not immediately, and the United Kingdom and other parts within Ireland. And we will try and stick to time. So the first speaker will speak for 30 minutes, and we'll have 15 minutes of questions. Then each of the other 3 speakers will have 20 minutes continuously speaking, and then we'll have maybe 20 minutes or so for questions and answers at the end. So apologies on my part. As you know, organising these types of events is difficult when not everybody has their own particular job, so I'm sure there are some mistakes that we've made. You will hopefully get an opportunity to give feedback to us. We appreciate feedback during the day on a verbal basis. And Steve, who you may have met outside, he will also try and send you an email, and you can provide us email feedback as well in terms of what we did well, what we didn't do so well, and more importantly, what we want to get out of this is that this is not the end of the discussion on climate change and health, but what can we do in terms of going forward. I think today is quite a broad focus on the whole topic, but maybe we can have more focused discussions on particular issues. Like just for example, in terms of myself, my own profession is environmental health. I work as a consultant on environmental health and water sanitation and hygiene in humanitarian contexts and more development settings. And I have a particular passion on the issue of air pollution and indoor air pollution, or household air pollution in particular. And just to give an example, I went to South Sudan a number of years ago, and I went into someone's home. I love going into people's homes. You're very privileged to get into someone's homes. And there was a woman there, and she was breastfeeding her baby. Her baby maybe was 4 months old. And in terms of health-seeking behaviour, you say, that's fantastic, that's what you want to see. But as soon as I walked into the túcal or the house, my eyes were beginning to stream, my lungs were beginning to cough up, because they just finished cooking inside the home. And there was a huge number of pollutants in the room, and I'm thinking to myself, yes, in terms of health, yeah, we've got some behaviours being done correctly, but there are other aspects in terms of protecting this child's health that are not being followed through on, and we're not maybe connecting the dots, so to speak. So that's from my own perspective, some of the issues I'd like to see going forward in terms of global public health. The other aspects to the context of today is, or not today, but Tuesday is World Environmental Health Day. I don't know if you're aware of that. It may not be as well known as World Toilet Day, which occurs every year in November. That is not a joke. There is a World Toilet Day. And the theme this year is on indoor and outdoor air quality. Another thing to reference is a thing called the Geneva Pledge, which the Irish government signed up to in 2015, where we kind of recognise that we cannot overlook the injustice faced by the poorest and the most vulnerable people in our world who are disproportionately affected by the impacts of climate change. So we as a nation have said that we will not overlook the injustice associated with climate change. There was one other thing I was going to mention, but I've forgotten. I think it's the Ministerial Declaration on Health, Environment and Climate Change, which was signed following the Conference of the Parties in November of last year. And it says that we have an important opportunity for action in terms of addressing climate change from a health perspective. Okay, I'm not going to wander on any longer because I'm all over the shop. I'm going to introduce our first speaker, Nick Watts. If I can find his bio now, is the next thing. Nick is the Executive Director of the Lancet Countdown, tracking progress on health and climate change, an independent and multidisciplinary research collaboration between academic centres around the world. He is based at the University College of London's Institute for Global Health, and this is a continuation of the 2015 Lancet Commission on Health and Climate Change. The countdown tracks and drives progress towards a world which is responding to climate change in a way that protects and promotes health. Nick is a medical doctor by profession, having qualified from the University of Western Australia and trained in population health and public policy. He also works as the director of the UK Health Alliance on Climate Change, which brings together the UK's major health institutions, including the BMA, the Lancet, the Faculty of Public Health, and the Royal College of Physicians, Nursing and General Practitioners. The Alliance aims to support the health profession and engage government in accelerating a transition towards a healthier climate. So many thanks, Nick. You're very welcome. Find your presentation. I think it is down here. There. Yeah. From the beginning. Okay.
Perfect.
Off
Thank
you
you. And Niall, I have 2.5 hours?
Yes.
Yeah. Fantastic. So firstly, thank you very much for having me here. Thank you to Niall, thank you to Steve, to Dermot. It's a great pleasure. Thank you for the introduction. Niall, obviously you missed what I hope is now immediately apparent, but the most important part of my biography, which is that I am Australian. Yeah. If you can't understand me at any point in the next 2.5 hours, because my accent is a little too strong, I apologize. There's absolutely nothing I can do about that. Okay. We've got about half an hour, and I thought that perhaps we could spend that time talking through three things. On the one hand, the health impacts of climate change. On the other hand, some of the opportunities or ancillary benefits that might come from a response to climate change. And then thirdly, maybe place those two concepts in context where we are a month to 2 months out from the next round of negotiations within the UN Framework Convention on Climate Change. How does that sound? Great, okay. I remember back somewhere through my surgical training, I had a lecturer who told us right up front that he knew we weren't going to listen to the rest of his 2.5-hour lecture, and so he was just going to tell us what the three key messages were to start with, and I think I might do the same thing here. 3 key messages. Climate change, left unmitigated, has the potential to reverse and undermine the last 50 years of gains that we've made around the world in public health. Number 1. Number 2, taken as a whole, the response to climate change presents us with the biggest global health opportunity of this century. And message number 3, whether we move from climate change as a threat to climate change, to the response to climate change as an opportunity, is now no longer a question of technology, of technical expertise, of economics, of finance. It is now entirely a political question. Those are the 3 key messages. Thank you. Okay. I'm going to talk through those 3 key messages using something that's familiar to me, because that's the easiest way to do it. From my perspective, I'm going to talk about a series of collaborations that the medical journal, The Lancet, has been engaged in over the last decade or so. It's had an active interest in exploring and understanding and reporting on the links between public health and climate change. And it does that in the way that a medical journal, of course, does, which is to present reports. It's done a number of these in 2009, 2011, 2015. And in 2015, when we launched our 2015 Lancet Commission on Health and Climate Change, we sat down with the editor and realized that this sort of one-off approach probably wasn't quite cutting it. And so came up with a new concept, something that we call the Lancet Countdown on Health and Climate Change. The countdown brings together many of the fine institutions you see up there, many of the world's leading bodies on either climate change or on health, public health, and looks to track a series of indicators. We track 40 indicators of different aspects of the relationship between public health and climate change, and we report on those every year in the Lancet. And we report on those 1 year before COP, which means that we have a publication coming out in 37 days, 37 and a half days, 37 days and 8 hours. And so I'm going to talk through some of those. I'm going to show a couple of preliminary findings from what we're about to publish in the Lancet. Are we live streaming this? Fantastic. So my communications team watching this will be having a heart attack now when I tell you that I'll be showing some of those slides, but that's okay. And we're going to talk through this very broad, very unhelpful diagram. I'm full of unhelpful diagrams. It's a very broad conceptualization of the links between public health and climate change. Up the very top, we have greenhouse gas emissions, working through to sort of the blue, the orange, the pink, and the yellow of various changes in the environment. It's probably pretty difficult to see, and I wouldn't worry too much about that because as I said, it's an unhelpful diagram. What it does do, if you have the time to go through and look, is as you mouse over on our website, each of those arrows, you start to see the papers and the studies that come up that demonstrate and best sort of elucidate those links. But when we're talking about the links between public health and climate change, we conceptualize these into the direct and the indirect impacts. In terms of the direct impacts, these are the impacts of climate change on human health that come directly from changes in weather. So we talk about changes in the strength or in the frequency or in the location of extreme weather events like heat wave, like flood, like drought, like storms. And we talk about the impacts that has on human health, whether that is direct injury, whether it's spread of waterborne diseases after a flood, whether it's the sort of transitional health impacts that you see from a drought in terms of malnutrition. And that's then when we move on to those indirect impacts. The indirect impacts of climate change on human health take those changes in weather and they look at what happens when that interacts with social systems and with other environmental systems. And we start to see changes in the pattern of the spread of vector-borne diseases. We start to see changes in the burden of vector-borne diseases. Or we start to see the breakdown of social structures when as a result of the drought that we were just talking about, a certain area of land becomes suddenly unviable because the sort of arable land there that was previously supporting the population and supporting their health is no longer quite what it used to be. And you end up with all of the health impacts that you might see from there in terms of malnutrition, the stunting, and I'm sure that Jodi can talk to us a little bit more about that. But then also potentially migration. Populations have to move in order to seek out the kinds of environmental health services that we take for granted. This is where I'm going to start to show some of those diagrams that I probably shouldn't show. What we do is we track a whole series of links between public health and climate change. Here we show two that we're reporting on. It's looking at changes in drought and changes in flood. Sort of extremes in both directions of precipitation. The blue line there is broadly sort of us taking from one of the climate models and projecting forward 2020 to the end of the century. There's nothing particularly new about that. What is new in the work that we're doing is we're looking at medically vulnerable populations. Populations vulnerable to drought, vulnerable to flood from a public health perspective and from the sort of social institutions that they're having to rely on. And that's the red line. And so projecting forward, what we find is that if we just look at the climate and we don't think about how populations are changing over the course of this century, we're going to misunderstand and we're going to underestimate the risks that climate change present to human health. What you see there is a 1.4 billion what you see there by the end of the century in terms of drought is an additional 1.4 billion exposure events to drought, an additional 2.3 billion exposure events to flood by the end of the century globally. Those numbers start to get sort of so large that you talk about sort of health systems being unable to cope, and you talk about Bangladesh, for example, with a quarter of the country underwater. Some of those impacts in terms of flood are particularly relevant in this country, particularly relevant in this part of the world. Something that's potentially sort of less immediately relevant in this part of the world is looking at sort of agricultural loss, malnutrition that you start to see. For every degree of Celsius, sort of at a global average, oh, there you go. That's my communications officer messaging me to tell me not to show these slides. For every degree of Celsius that we see sort of rising from next year on, we expect a 6-degree fall in sort of global wheat production, a 6% fall in global wheat production. Taking that forward to the end of the century, left unmitigated, and this is all sort of business as usual scenarios, you end up with a 63 to an 82% reduction in global maize production. These are some of those sort of core staples that, from a child's perspective, from public health perspective, people rely on. But that's just the production. If you then sort of follow that through, what you find is that governments do and communities do a fantastic job of maladapting to climate change. When there is a food shortage, we don't have a food system that sort of lets us immediately distribute food more equally and make sure that there's enough to go around. Instead, countries start to hoard. Prices start to spike. It becomes harder for the most vulnerable in society to gain access to the staples that are being threatened. And then we look at an increase of 7 million children malnourished by 2050 in Southeast Asia, under the age of 5, and an increase of 9.4 million in sub-Saharan Africa by 2050. So that's 7 million Southeast Asia, just over 9 in sub-Saharan Africa. Again, the sorts of numbers that you start to talk about, it's sort of difficult to conceptualize. Because they start to dwarf the scale of what we've already been talking about or already facing in global health. And I think that, for me, is one of the key messages that comes up when you start to look at this, is that climate change acts as a threat multiplier for many of, if not all of, the challenges that we are already facing and already tackling in global health. This here does a similar thing to the precipitation graphs I was showing before. The orange line there, with the one difference that we're now looking historically. Before we were projecting from 2020 to 2019, now we're talking about 2000 to 2016, to the year that's been. And we're looking at, in this case, change in the length of heat wave. And we have similar graphs that we report on in the countdown that look at change in exposure for different vulnerable populations to heat wave. The orange is what you would expect to see if you were only interested in where heat waves are occurring around the world, independent of where people were, independent of where land masses were, and independent of where vulnerable populations are. The blue is what happens if you start to aggregate that up and look at what's happening to the sort of populations that are exposed. And all of a sudden, things become far more concerning. Not that they weren't concerning before. There, built into that, we build in a 12-point criteria is what we define as medically vulnerable, but it's basically things like children under the age of 6 months old, adults over the age of 65, any person with end-stage CKD, people engaged in outdoor manual labour as part of subsistence agriculture, so primarily reliant on that for their livelihoods. And then finally, just to draw out one more of those different sort of health impacts of climate change, we talk about the spread of vector-borne diseases. And things get pretty complex pretty quickly, because I'm sure there are people in the room that know much more about the spread of vector-borne diseases than a surgeon from Australia. But we end up with all sorts of things that change the way that it spreads, whether that is the reproduction cycle of certain mosquitoes, whether it's the way that the pathogen within the glands of that vector sort of multiplies and changes, whether it's just changing the fact that normally in Brazil, Aedes aegypti, the principal carrier of chikungunya, of dengue fever, and at the moment of Zika there, whether it's simply changing the fact that normally it has to get to a certain sort of temperature for Aedes to come out, and they're pretty sensitive to that, so it has to cool down a little bit. Normally Aedes starts to come out in parts of sort of urban Brazil around 10 o'clock at night. And by then most of the population has gone to bed, hopefully, or not. As you start to see climates changing, you start to see that temperature, that sort of temperature window shifting, and you start to see Aedes coming out earlier. So it's not necessarily that there's anything changing in the vector, it's more that now there's an interaction between population and vector, and you start to see certain spikes. Number 3 of my incredibly unhelpful diagrams. The colours don't show up quite well enough to give a picture, but effectively this is one of our models that we've built looking at, from 1950 to present day, changes from Aedes aegypti and Aedes albopictus in terms of, it's a model of dengue transmission from those two vectors, drawing out the climate signal that supports and drives that. Blue, on the one hand, positive. Blue's not too bad. Red, as things start to shift, it starts to support more endemic and more endemic spikes of dengue fever. back to my unhelpful diagram. It's unhelpful if you want a simple overview of the links between public health and climate change, if you want to talk through the direct and the indirect impacts of climate change, I think. Where I find it helpful and why we created it is for two reasons. For me, it reminds me of the multi-hit scenario. It reminds me of what happens when a community that was already not doing too well to begin with gets hit with a flood or an extreme storm, extreme wind event, that it wasn't expecting. It was just a little bit stronger than it was used to. And that flood knocked out the power and it knocked out the transport system around the hospital, but that's okay because the hospital had a backup generator. And then suddenly halfway through the night, it's not okay because the generator was in the basement and that flooded as well. And so now you're evacuating a hospital. And eventually the community gets over that shock. But in the wake of that shock, there are spikes in depression, spikes in schizophrenia, all sorts of mental health disorders that come as a result of some of these extreme weather events. And then there are also spikes in waterborne diseases, cholera. And then 6 months later, exactly the same event, 12 months later, exactly the same event hits again. It's normally an event that hits once every 10, 20, 50 years, but it's coming more and more frequently. So this reminds me of the multi-hit scenario where you see the spread of infectious disease, where you see some of those downstream effects, where you see increases in the strength, severity of extreme weather events on one community, and you start to wear away at the adaptive capacity of that community. You start to wear away at the health system's ability to respond. And it also reminds me of my first key message. Left unmitigated, climate change has the potential to undermine the last 50 years of gains in public health globally. Okay. That's only half of the story. And as Niall said, we're here to talk about the threats that climate change presents to human health, as well as the opportunities. And these 5 are going to help us do that. We're going to talk about some of the health benefits of a response to public health, to climate change. We're going to do that using unhelpful diagram number 3. It's another unhelpful diagram, but it is more helpful if you're online. You can go and look it up. Each of these lines on the side closest to me identifies a range of different interventions you might want to put in place in order to respond to climate change, in transport, in energy, electricity generation, a whole range of sectors. On the other side, we see some of the social, the public health, and the environmental benefits that we expect to see as a result of that. And you can mouse over each of these and you can figure out what some of those studies look like. It's not a comprehensive overview, but it does provide a sense of the weight of evidence that we have behind some of these co-benefits. And much of the response is positive. It turns out that when we sat down in 2015 with our engineers and our economists and our political scientists, and when the doctors said, what do you want to do to respond to climate change? Much of it just looked like common sense public health interventions. They were things that we were trying to do anyway, that doctors and public health professionals and nurses and the rest of the allied health profession had been trying to do anyway for a very long time. And so this is where we sort of talk about the health co-benefits of mitigation. Okay, so this is a diagram in light of World Environment Day focusing on indoor-outdoor air pollution. This is a diagram of, on the y-axis, annual mean particulate matter smaller than 2.5 micrometers. So annual mean air pollution for one sort of component of air pollution. And on the x-axis, GDP per capita for the world's global cities. It's one of the studies that we sort of draw out in the countdown and add to. That dotted line there is the WHO's recommendation for safe levels of outdoor ambient air pollution. So the rest of the world is not doing too well. Thankfully, Australia actually does very well there, and I'm sure that Galway probably does fairly well there, but I don't want to speak out of turn or speak of what I don't know. We see a huge problem in terms of outdoor ambient air pollution around the world. Globally, for total air pollution, estimates range somewhere between sort of 6.5 to 5.4 million deaths every year, probably towards the higher end of that range. And when you look at the source of those deaths, when you look at the source of, particularly in the case of outdoor air pollution, those deaths, you fall in two sectors. You fall in transport, and principally road transport, and you end up looking at electricity generation, and principally coal-fired power. And you end up talking about the 800,000 deaths in India and China every year that result from particulates and other heavy metals, and heavy metals from coal-fired power alone. And that's where you end up talking about some of these health co-benefits, because it turns out that responding to climate change, one of the easiest, earliest things that high-income countries, middle-income countries, and even increasingly low-income countries should be looking at doing, and are looking at doing, is phasing out coal-fired power. It's something that the United Kingdom announced it was going to do 2 days ago, I think. And increasingly we're seeing countries all around the world starting to take this nice, easy, early step. And it's easy for a few reasons on the energy and the electricity generation side, but it's much easier when you just consider the public health impacts or the public health benefits that you start to see from a reduction. And so when we look at how the world's doing, the work that the Countdown does is we track. We have up to 2014 on this slide, but we'll publish in a few weeks up to 2016. We start to see some changes. So we see there, broadly, the world has been decreasing its reliance on coal-fired power. 2 countries have dominated the increase recently, India and China. When we carry forward another 2 years, that green line starts to fall further. And we see that China is starting to take some very impressive steps to reduce its reliance on coal-fired power, but so is Europe. France has announced its intention to phase out the last of its sort of what's left of a coal-fired power plant, the United Kingdom, and a number of other countries. Not every country though. Germany still, Poland still, heavy reliance on coal-fired power. And so we talk about these as these co-benefits, interventions that help you both address climate change, but actually are just cost-effective, sensible public health benefits in their own right. Is this an unhelpful diagram, or is this sort of just barely helpful? Yeah, let's say 4.5, 3.5. This is talking about the health co-benefits of climate interventions on climate change in a different sector, in a sector that's maybe more familiar to this group, which is the healthcare system. This is a diagram of NHS England's national emissions. And it walks through some of the work that a group, the Sustainable Development Unit, which is one of the directorates of the NHS created by the UK's Climate Change Act in 2008, has been doing. It's been looking to decrease the emissions of the national healthcare system. And when they did their audit recently, and they looked at what's changed from 2008 to sort of present day, to the start of this year, they found some pretty impressive things. They've managed an 11% reduction on their CO2 equivalent emissions, on their greenhouse gas emissions, over that period of time, over about a decade. And that's pretty impressive, especially when you consider that that's on the background of an 18% increase in activity within the NHS. So it's not that less things have been happening, it's that they've been doing them more efficiently. And what's better, they did a couple of polls of this sort of data, and they asked people about some of the interventions that they were doing. They found on average there's a sort of 92 to 96% level of support for these interventions from the public and from the patients that are dealing with them. And that's because they're not presented as climate change interventions. In fact, if you go into a hospital in the NHS, you wouldn't realise that they were doing these for climate change reasons. They're doing these, again, for sensible, cost-effective public health reasons. Devolution of care, moving away from a focus on tertiary, high-technology hospitals and encouraging public health, encouraging and strengthening primary care. These are just sensible things that we've been trying to do for a very long time. It turns out that some of those interventions have all sorts of benefits for the climate as well as patient benefits. I think it's right to say that they managed to overshoot their target. Their target was 10% in 10 years, a 10% reduction. They got to 11%. They tell me that additional 1% is roughly the size of the emissions of Malta, which blows my mind in terms of how big the NHS must be as a single unit. But that's said from an Australian. You find these sectors the whole way through. You find it whether you're talking about household air pollution and building efficiency, whether you're talking about making cities more livable, encouraging physical activity, active transport like walking and cycling. You find it when you're talking about the healthcare system, when you're talking about power generation. Taken as a whole, all of these responses across the full range of how we want to respond to climate change can add up to be the biggest global health opportunity of the 21st century. Key message number 2. Don't worry, key message number 3 doesn't take us too long. I still have 2 hours and 20 minutes, so it's 7 minutes. All right. Well, we'll might skip a couple of slides there. That's okay, because we're going to move on very quickly to the third key message. The third key message was something that surprised me, and we were talking about just before. When we sat down in 2015, we are this large collaboration. I showed up a bunch of logos that probably don't mean very much, but the collaboration brings together engineers, climate scientists, physicists, mathematicians, philosophers, lawyers, economists, political scientists, and somewhere along the end, a couple of health professionals. But when the health professionals sat down and asked the climate scientists and asked the engineers and asked the economists, what is it that you want to do to respond to climate change? They gave us a long list and we said, oh, well, those are things that we wanted to do anyway. And then we said, and what do you need to get the technology ready? What do you need to get sort of the energy technology ready? Or what do you need to get the sort of transport system ready to respond? Why isn't the technology ready? And the response from the engineers was, no, it's ready. We're ready to go. It's been ready for quite a while. And so we assumed it must be a problem of economics or of finance. We turned to our sort of economics working group and we asked them a similar question. Why haven't you got your act together? Why haven't economists started to fund and implement some of this stuff? And they said, well, it's not actually a problem of money. It doesn't actually cost quite as much as you would think to drive some of these transitions to a low carbon economy, in part because of the huge benefits that we see for society, for communities, and for public health. And that led us to our third key message. Whether we move from climate change as this enormous, unprecedented threat to human health, whether we move from there to the response to climate change as one of the biggest global health opportunities of the 21st century is not a technological question, it's not a technical question. It's not easy to do, but it's not a technical question. That's not the barrier. It's not an economic question. It's now entirely a political question. Whether we make that transition is now entirely a political question, and that places us firmly 2 months out from COP23, from the world's climate change, sort of annual climate change negotiations coming up. It'll be the first time that we will be speaking about climate change as a sort of global community without, sorry, I shouldn't say without. It'll be the first time we'll be speaking about climate change and speaking about the Paris Agreement with the knowledge that the United States intends to pull out of the Paris Agreement. And that's an important moment. It's going to be a difficult set of negotiations and a difficult set of discussions, but what's more important there is that the rest of the world continues to act as they have. When the United States pulled out from the Paris Agreement or announced its intention to, I was sort of initially pretty upset. That lasted about 6 hours until I woke up the next morning and read the news and started to see shows of support from 150 other heads of state about their commitment to the Paris Agreement, and started to see sort of discussion, and we saw from the former executive secretary of the UNFCCC this fantastic line that the direction of travel is set. All of the countries around the world are moving as fast as they can in a direction in terms of responding to climate change. And I think it's just particularly important to note that we're going to start to see that come up and come into question again in 1 or 2 months, and anything that can be done through the National Climate Dialogue, anything that could be done to have a show of support for the Paris Agreement and for continued implementation, regardless of other sort of political uncertainties, I think is incredibly important. In terms of our part and what we're looking to do, 1 week before COP23, on the 31st of October, we're publishing, this isn't quite an unhelpful slide, but it's not particularly helpful, a series of indicators, 40 indicators of different aspects of the relationship between public health and climate change. We look at the health impacts of climate change, the exposures and the vulnerabilities that we see around the world, and we publish this on a national level. We look at the extent to which health systems are adapting and responding to climate change, and the extent to which cities are responding to the health threats that they see. We look at some of the mitigation actions and the health co-benefits of those mitigation actions, and we publish this around the world. And then we look at the economics and finance to enable that, and finally, the political and the broader engagement. It's an opportunity for, I think, it's an opportunity for the world to start telling some of these positive stories. Some of the messages that come out of this when you take a global look at that are incredibly positive. We see these glimmers of hope in coal phase out. We see these glimmers of hope in uptake of electric vehicles starting to hockey stick. Don't get me wrong, there's plenty more work to do, but it's not quite as negative and not quite as depressing. as you might think if you turned on the news every day and had a read of what's happening in climate change. But there is still a fair bit more work to do. Anyway, I'm going to end there. I had 3 key messages. The health impacts of climate change have the potential to undermine the last 50 years of public health. The response to climate change could be one of the greatest global health opportunities available to us for this century. And whether we move from threat to opportunity is now entirely a political question. Thank you very much.
Thank you very much, Nick. You said we had a problem with his accent. I don't know if you could understand him for the last 30 minutes, but just to let you know, this event is being streamed and it is being recorded, so we can put in the translations afterwards for you to read it. I forgot in my mumbled introduction was to welcome you all to Galway, and thank you all very much for coming to Galway, and also to thank NUI Galway for hosting us in this beautiful building and this beautiful room. We have about 15 minutes for questions, so we can take questions from the floor, and maybe we'll start with yourself. Yeah. Yeah, please introduce yourself, where you're coming from, maybe, and we'll get you a microphone.
I'm a GP in Limerick.
One second, man.
Okay.
I have no idea if it's the one I just had it.
Just a switch. Yeah, okay, great, thanks. Thanks, Nick, that was a great talk, and I did do my best to try and work through your very complicated diagrams. I like to simplify things to understand them, and climate change is a complicated problem, but in another sense it's a simple problem. It's essentially an energy issue, and in my mind we need to decarbonise electricity and electrify everything, and that way we deal with air quality issues and we deal with emissions, greenhouse gas emissions. I appreciate that there's agricultural issues and ruminants and methane and all that can be dealt with separately. I appreciate that you highlighted zero carbon electricity rather than just renewables. Stand up for nuclear power, okay? Your homeland is the only G7 country that doesn't have nuclear power and use some of the dirtiest electricity in the G7. Okay, the only other country with comparably dirty power is Germany, which is phasing out its nuclear power. Okay, you lauded the achievements of China, which is doing it on the basis of a massive nuclear power building program and a massive renewable push. So they have a sensible attitude. They're building nuclear, they're building turbines, wind turbines, they're putting out solar panels, okay, and that's what's leading them to achieve their reductions. Germany's emissions went up last year, they went up the year before, they opened a new coal plant in 2015, Moorburg. So I think we should look at who's leading, who's winning globally, and follow the people who are making progress and not the people that are failing, like Germany. And you talked about the United States pulling out. We should be careful about the attitude that we have here in Ireland to the United States, because we're falling over ourselves to buy their fracked gas here in Ireland. Down in Cork and in Kerry, they're fighting who's going to land it and who's going to process it. Because if we don't put in baseload low carbon energy, then we're going to have to replace it with a cleaner fossil fuel, which is not going to achieve any objectives that we need to attain. Thanks very much.
Thank you. Would you like me to? I might comment or respond. I unfortunately can't stand up here, although I will when we're talking about the rugby. I will defend my country. I can't stand up and defend their record on sort of their interventions to respond to climate change. But absolutely, I agree. Germany probably deserves a little bit more flack than they've been getting. You know, usually we look at Germany as a sort of global leader, and absolutely they are doing some impressive things when it comes to responding to climate change. But one thing they haven't been doing is around coal and it's around sort of electricity.
You have to measure by emissions, though.
Sure, absolutely. I'm not sure I would entirely agree that that sort of electricity is the only, and sort of energy is the only sector that matters. But absolutely, it's one of the lower hanging fruits, and it's one of the areas that we have to tackle first. I often find it unhelpful trying to get the power generation sector and the transport sector and agriculture arguing together. I think we're doing all of this at once, is the idea. But anyway, I might.
Any other questions? Yeah, we'll get the microphone to you first.
Hi, I'm Eve Van Rijn from the University of Limerick. I'm an environmental scientist. I just wanted to know, you mentioned that you're tracking 40 indicators as part of the countdown. And do these indicators, do they relate to the Sustainable Development Goals, the UN agreed Sustainable Development Goals? And how did you choose the indicators? Because indicator assessment is so tricky, and choosing the right indicators is almost as difficult as actually tracking the indicators themselves. You know, if you're not tracking the correct thing, you get what I'm saying?
No, I do.
Yeah.
Yeah. Sure. So to answer 3 parts of a question in slightly muddled order, our approach was to put everything on the table, to figure out what the world already knew about the links between public health and climate change and where the data was available and what was already being tracked. We then, over about 6 months, opened ourselves up for a global consultation. We put out our thoughts on about 80 indicators that we thought we could track, and we asked the world what they thought. They thought most of them were rubbish. They provided probably what was almost an unhelpfully overwhelming response in terms of people with new suggestions, new sort of areas of data that we'd missed, and new sort of things that we needed to track. In the end, what we selected was a pragmatic sort of approach. We knew the areas that were important from a sort of health and climate change perspective, but we also knew that globally there was huge data limitations, and that we aren't we aren't trying to replace or get in the way of any of sort of the major research collaborations out there. We're looking at this from purely a public health perspective. So partly we were trying to be pragmatic with the methods that we use, partly we were trying to lend ourselves towards things that had the data available for us to be able to sort of draw and conduct that new analysis on. But I think also we were very comfortable with the idea, or we are very comfortable with the idea of an iterative approach. So we track exposure for some of these vulnerable populations to heat wave. Now, as any public health professional knows, exposure is one thing, but what we really want to get to is outcome as well as exposure. We're not at outcome yet in terms of sort of the health outcomes of heat wave globally, and we have a plan to get there, but we're okay with, in 2017, presenting the numbers for exposure and then developing and iterating on that going forward. And I think usually when someone says you should improve on this, or you should add this data method, or you should add this data or this method, unfortunately for that person, the immediate response is absolutely, can you come and help us do that? And we throw it back on them a little bit. In terms of the Sustainable Development Goals, yes, we have a number of our indicators that line up fairly directly, and some of them slightly more indirectly, with the SDGs. What we probably find is that if you took SDG 13 and looked at the indicators within that, they are approaching climate change principally from a climate change perspective. And so they don't necessarily, or wouldn't necessarily, pick up on the health impacts and the health dimensions of that problem in a way that the Lancet countdown does, and nor should they. And so there are certainly areas that the SDGs and their indicators don't pick up, but we've been working with the team there to try and sort of identify a few areas where we could collaborate a little bit closer. We also find with the Sendai framework on disaster risk reduction and the indicators that they'll start reporting on in 2021, we find overlaps there, and again, areas that we'd like to work together.
Okay. Other questions or comments?
Just wanted to ask, in your last point, you were talking about you were talking about being a political question. Could you just give an example of what kind of political barriers are we looking at?
Sure. Talking in the abstract, climate change presents an unusually difficult problem for governments to deal with for a bunch of reasons. You can't see it, right? You can't see the emissions, so it's not something that's tangible. Parts per million of CO2 equivalents up in the atmosphere aren't something that you, me, sort of any of us naturally understand. The emissions we put out today, A, are the result of decisions we made 10 years ago, and B, the effects will be felt 10, 20, 30 years into the future, right? So there's a significant time lag, and that time lag often extends beyond the 3 to 5 to 6 years of an election cycle. I think the other problem that we face that is particularly insidious is that initially the health impacts of climate change fall on, and the broader impacts of climate change fall on populations who are least responsible for their creation, for climate change's creation. So they fall on, and consequently, those that are least able to respond and least able to sort of do anything about it. So we have a sort of inequality issue baked into climate change. That's why the Lancet is engaging in this, because we think that we have health solutions to this. Rather than talk about parts per million of CO2 equivalent, we're going to talk about childhood asthma. We're going to talk about concepts that are more tangible to the everyday sort of person. Rather than talk about the health impacts of climate change in 2100, or the impacts of climate change in 2100, we're going to talk about the immediate health co-benefits that you start to see when you set up a more livable city or when you shut down a coal-fired power plant, those immediate benefits. There's a great study in Poland that looks at a coal-fired power plant shutting down, and 3 months later you see this sort of fantastic drop in admissions to the emergency department from exacerbations of COPD and asthma. We're going to talk about things that are present today, things that are more certain in terms of some of those health benefits, and things that are more tangible, I think, to the every human sort of experience. Does that answer your question at all?
Yeah.
More or less?
Excellent talk, Nick. I really enjoyed that. Jonathan Derham from the Environmental Protection Agency. I just wanted to explore, we're looking at a very global, but what are the challenges, for instance, in an Irish context of downscaling all of those concerns to what would be, you know, the topography for health concerns in a national context, you know, whether it's Ireland or whether it's Australia. So what do you see are the key challenges in downscaling those kind of global concerns to regional level?
Yeah, sure. We have this fantastic problem that we've run into. The paper that I'm talking about was accepted by the Lancet a couple of days ago, which we are all very relieved about. And then we went and presented it, sort of preliminary findings, to a whole range of people, and they said, well, that's global. And we said, yes, that's what we set out to do. And they said, well, I live in Galway. And rightly, they asked the question, you know, you're presenting us with sort of global impacts, but in order to make sort of decisions at the local level, I need local information, and I need that information to be timely. I need to know what's happening today or tomorrow, not what's happening in 2100 necessarily. And there you run into some pretty serious problems. It gets difficult from a climate change perspective to sort of downscale the resolution for a whole range of reasons. Where, again, public health potentially provides some benefits is you can almost sort of do what the Commission and the Countdown do in terms of the responses, and look at, well, which of these responses yield some of the most immediate public health benefits. When we take into account some of the cost savings that you see from either a more productive workforce or from decreased costs to the healthcare system, which of these start to look and feel cost effective? Because you take out the need to sort of run almost through climate change and are just looking at the direct benefits of those interventions. I'm aware that doesn't fully answer your question, but...
I'll take one more question for now, but we have a panel session at the end of the other speakers, so there will be an opportunity to ask any more questions. So please ask your question.
Hi, my name is Saiv. I'm a junior doctor. And I was just wondering...
Could you wave for me?
Yeah.
Hi.
Hiya. You were saying that the health impacts fall mainly on the least responsible population, so more in developing countries. But if you're talking about climate change and health impacts here, and you're trying to get people here more engaged and more interested, and they kind of can use that response as a, well, it doesn't affect us here in the same way. So what do you say then are the main effects for people, say, in Ireland or the UK?
Would you permit me to use examples from the United Kingdom, because that's the setting I'm most familiar with? In part, as well as this research collaboration, we run an alliance of all of the Royal Medical and Nursing Colleges on climate change, and so we have to come up with answers to these questions. In the United Kingdom, the health impacts or the risks that they face are either principally around flood, heat, cold, or the spread of a few sort of tick-borne diseases. And they're starting to see some of those impacts. The sorts of discussions we engage in are either a similar answer to what I was talking about there, which is we talk about the benefits of the response. So we talk about healthy diets, physical activity, and cleaner air. Or we talk about sort of the potential viability or the risk to the NHS. So we talk about the fact that currently 11% of NHS facilities are on high-risk floodplains, situated on high-risk floodplains, and 18% of NHS hospitals are on high-risk floodplains. Going forward, we expect that number to triple by sort of mid to second part of the century. And so we talk about sort of the viability of some of those deeply, beloved institutions going forward. It does mean that we end up, the numbers you're talking about are smaller, but they're still not that small. The numbers you talk about in terms of deaths from air pollution, for example, around 40,000 deaths in the United Kingdom every year. That's substantially higher than a whole range of other public health priorities that have significantly sort of higher political attention. We often say of air pollution, if 40,000 people were dying from something in the water that you were drinking every day, there would be outrage on the streets, and yet we accept that level of sort of a burden of disease when it comes to air. Again, you can't see it. It's not something that, anyway.
Thank you, Nick.
Thank you.
Okay, thank you very much. We're going to invite our second speaker, Joni Pegram, to come up. Joni is the Senior Policy and Advocacy Advisor on Climate Change at UNICEF UK. Her work focuses on the impacts of climate change on child rights, as well as child rights-based approaches to climate action and solutions. In the past, Joni has worked as a consultant to the United Nations Environment Programme, in addition to posts at the European External Action Service and the UK's Foreign and Commonwealth Office. Joni, please. Try and close this. There. Slideshow. It's Billy. In the beginning. Okay.
Lovely, thank
20
you.
minutes.
Okay. Well, thanks, Niall, and hello, everybody. It's a pleasure to be here. I wanted to start, Niall had said at the start it shouldn't be all doom and gloom, and that's a bit of a challenge for me because I think when you work on child rights and climate change, it's quite a sobering kind of area of work. But nonetheless, I will talk a little bit about some of the kind of grounds for optimism and opportunities I see as well. So maybe to start, a brief introduction to UNICEF, which is the UN Children's Fund responsible for providing humanitarian and long-term development assistance to children and mothers around the globe, focusing special attention on reaching the most vulnerable. And we're present in 190 countries and territories. And our mandate is really to uphold the Convention on the Rights of the Child, so the rights set down within that, which is the most widely ratified international human rights treaty. There's just one country in the world that hasn't ratified. I think South Sudan and Somalia were the last two in the last couple of years that did ratify. But sadly, the US is still not one of our members, and that's not a situation we see sort of changing in the next couple of years, probably. So the Convention sets down a set of rights which are specific to children, recognising their particular vulnerabilities and needs in addition to the human rights that are available to all humans. And it includes, notably in the context of today, the rights of the child to the enjoyment of the highest attainable standard of health, including that states should take appropriate measures to combat disease and malnutrition, taking into consideration the dangers and risks of environmental pollution. Now, the reason we talk about rights is because often when we talk about children, they're sort of talked about in a narrative of most vulnerable, sort of passive victims that we have a moral sense of duty to help and to provide care for. But actually, children are rights holders, and countries have signed up to obligations under international law to uphold their rights, including their right to health. So I think it's very important that we see them in that context. So today I'm going to speak about the impacts of climate change on children's health, why children are particularly vulnerable, some of the gaps and the challenges we have in terms of climate change policies on the one hand, not addressing children and their health, and then child rights policies, child rights focused kind of policy areas which don't take into consideration environmental risk and climate change. Some of the recent evolutions that have come about and the fact that this is an evolving situation under sort of international frameworks at the moment, that's quite exciting. And that's to counteract the doom and gloom. And then, if I have time, then just a couple of examples of UNICEF's work to kind of showcase concretely and tangibly what we mean by a child rights-based approach to these challenges. So to start with this slide, which is really intended to provide a snapshot of the multiple ways in which children's rights, particularly their right to health, is undermined by the impacts of climate change. And this is a quote from the president of Vanuatu following Cyclone Pam in March 2015. And he said, "All the development has been wiped out, we will have to start again," which I think encapsulates very well the scale of the challenge we're facing. Obviously, since then, there's been Typhoon Haiyan, we've just had the recent destruction in the Caribbean. So this really does pose huge problems. Now, the key starting point for UNICEF is that children are among the most vulnerable to climate change impacts, because childhood represents a unique period of rapid physical and mental development, particularly between birth and the age of 5. And this is when children's bodies are most vulnerable to the conditions that climate change exacerbates and environmental risks exacerbate. So for example, in terms of malnutrition linked to drought, so looking at crop failure, desertification, these kind of risks, this is responsible for nearly half of all worldwide deaths of children under the age of 5. And for those that survive, the impacts can be lifelong. So undernutrition in the first 2 years of life can lead to irreversible stunting, which Nick mentioned, which is low height for age. And it affects both physical and cognitive development. And the current state of play is already pretty dire. 25% of the world's children are stunted, rising to 43% in DRC. And the president of the World Bank recently described the situation quite well. He said, "Inequality is being baked into the brains of a quarter of the world's children before the age of 5. So if you can imagine the implications in terms of their future health, their education, their livelihoods, the implications for entire societies, that's quite stark. And climate change is projected to increase severe stunting by 23% in Central Sub-Saharan Africa and by 62% in South Asia by 2050. So it's not really an overstatement to describe this as a sort of humanitarian disaster in the making, really, albeit one that's complex and not really being taken as seriously as it should be. Similarly, if we're looking at disease, rising temperatures, we've talked about, Nick was mentioning malaria, or the lengthening transmission season and expanding sort of geographic range of vector-borne diseases such as malaria and dengue. And the global burden of these diseases is really concentrated on children. So in 2014, 78% of deaths from malaria were among children under the age of 5. Drought, flooding, more irregular rainfall patterns. These are increasing the incidence of diarrheal diseases, which is another major leading cause of mortality for children under the age of 5, responsible for over 500,000 deaths of children under 5 in 2015. Now, on the top right, you've got a picture of a severe weather event in the Pacific. And taking a more holistic understanding of health, the implications, both physical health, but also psychological trauma during and after these kind of events for children, and the events obviously expected to increase in magnitude and frequency with climate change. The implications of that for children are immense. Children are more likely to suffer than adults, to suffer injuries or to die in the context of these events. And in the aftermath, they're at heightened risk of exploitation, violence, and abuse. Often as a result of family separation in the context of these events. Loss of livelihoods, which can lead to displacement and migration or sort of separation of families in that context too. On the middle left, you've got a slightly more controversial picture, which is to do with conflict. Now, obviously, linking climate change to conflict has been the source of some debate, but there is increasing consensus that climate change does act as a threat multiplier in these contexts. And obviously, that has conflict is well-studied impacts on child's cognitive development and physical well-being, and not to mention sort of availability for health systems and sort of infrastructure in place for them as well. And finally, in terms of the bottom right, this is a picture of children going to school. That's not fog, that's air pollution, one of the leading causes of child death globally, and plays a direct role in causing pneumonia, which is the leading infectious killer of children under the age of 5. Actually responsible for the death of children every 35 seconds, one child, which is killing more children than HIV, AIDS, and malaria combined. And children are more susceptible to air pollution than adults because their lungs, their brains, their immune systems are still developing, their respiratory tracts are more permeable. And pollutants that cross the blood-brain barrier can again affect their cognitive development, so lifelong implications there. And obviously this isn't just a problem that's confined to the developing world, this is very much a problem in the West as well. So that's a rather stark picture, but I think in addition to highlighting the fact that children have sort of a unique vulnerability because of their stage of development, it's important to recognise two other ways in which children are disproportionately affected by climate change. The first of which is that the regions and countries most exposed to climate change impacts tend to have a larger share of children as an overall share of their population. And that's certainly a trend that will be accentuated by demographic shifts in the coming years. So as a number, as a group, they're more affected. And obviously today's children will live longer as well and will experience increasingly severe and recurrent crises during their lifetime. So, the implications there in terms of the health burden, their future well-being, and health policies and costs as well is certainly something that needs to be taken into consideration. Now, the problem we see, one of the main challenges, is that children are already falling through the cracks. So the situation is that the relationship between climate change and children's rights has really not received the degree of attention that it requires in terms of coming up with policy responses. So children's rights have historically been overlooked in international negotiations under the UNFCCC. And the majority of national climate policies make little or no reference to children as well. The most recent round of contributions, nationally determined contributions to the UNFCCC, illustrated this quite starkly, I think. Less than 1 in 3 included reference to children, youth, or young people. And many of those references were really just very superficial in passing, so no sort of substantive analysis or sort of in-depth assessment of what was required. And on the flip side, policies and initiatives that address children's rights, notably healthcare, tend to touch superficially at best on issues such as climate change. And this is leading to a situation where there's a real lack of information and disaggregated data on the children most at risk and the measures required to address their specific needs. And that obviously has ramifications for programming decisions and budget allocations at the national level as well. So this is one of the key challenges that UNICEF is seeing and hoping to sort of bring about some change in this area to ensure that we're linking up these two sides of the house, absolutely essential for children's health. Now, at the international level, there have been some recent, I would say, evolutions, which are quite exciting. So recognition is evolving on the links between climate change and human rights, and child rights specifically, and often looked at through the lens of health. So numerous human rights bodies have made clear that states should protect against foreseeable environmental harm, including climate change. And notably, the Human Rights Council has been working on this. And these obligations can be categorised as follows. That states have an obligation to adopt measures to protect children's rights, including their right to health, from the harmful effects of climate change. And this should include both mitigation and adaptation action. And those measures that they take should be sufficiently ambitious to safeguard children's rights. And they also have an obligation to ensure that the measures they take, the measures themselves, respect and uphold children's rights. And that safeguards against situations such as we've seen with the building of green projects. So we're looking at major hydro dams, for example, in South America. There's been some examples where these are being railroaded through at the expense of local communities. So the intention may be good. We've had situations where local indigenous populations, for example, are being deprived of their land and access to water and food. In fulfilling these obligations, states also have so-called procedural duties, which are to assess climate-related impacts on children and make climate-related information available to children through child-friendly and language-appropriate materials, to uphold their right to participate and be involved in climate decision-making, and policy dialogue as well, and to provide access to effective and timely remedy for harm. And those obligations should also extend to the role of the private sector and harm caused by corporations in accordance with the guiding principles on business and human rights. And I think that's particularly relevant in the context of increasing amounts of climate finance being funneled through the private sector and their role increasing in that space. Now, the Committee on the Rights of the Child is the independent body which is responsible for monitoring implementation by states of their obligations under the UN Convention on the Rights of the Child. And they've gone further, and they've actually been very progressive in this space. and said that climate change is one of the biggest threats to children's health and exacerbates health disparities. States should therefore put children's health concerns at the centre of their climate change adaptation and mitigation strategies. Now, I can say safely at this stage that's certainly not the case. If countries are looking for guidance on how they should be addressing children and children's rights under their obligations within the context of their climate policies, then look no further, we have the guidance. And the committee often issues, so it does its reporting on each country every 5 years or so and issues very specific recommendations. Now, most of their recommendations to date on climate change have been to developing countries, but last year they did issue a recommendation to the UK government for the first time, issuing a recommendation to a developed country, including on climate change and linking this to air pollution. That's encouraging and certainly something that I've been using in my work with the UK government. Now, in parallel, there's obviously been exciting developments in the international climate change framework as well. So the Paris Agreement is the first ever international environmental agreement to explicitly recognise the importance of human rights obligations, including children's rights, in the context of climate change. And it says parties should, when taking action to address climate change, respect, promote, and consider their respective obligations on human rights, the rights of children, and intergenerational equity. And obviously, as the rulebook is being developed currently, we're yet to see whether that will actually be taken forward in the implementing decisions. And obviously, there's other relevant national and international standards that provide guidance for countries as well. The Sustainable Development Goals were mentioned, the Sendai Framework for disaster risk reduction, and both of these incorporate consideration of human rights as guiding principles. And they recognise that tackling climate change will be central for their achievement. And they also place emphasis on children's particular needs and vulnerabilities. So I think taken together, all of these developments do offer important opportunities to bring together these sort of siloed approaches to development, to children's rights and to climate change. The challenge has always been to bring these strands together and to translate those words into sort of urgent action required. And Niall had mentioned the Geneva Pledge. I mean, that's one initiative where we see sort of governments saying, yes, we recognise there's a problem here, there's a gap. At the national level, what can we do to bring together our national teams working on environmental issues and climate and health and rights? And how can we take that through to the international talks as well? I'm just going to finish then with a couple of examples from UNICEF's work to really illustrate what we're talking about when we talk about a child rights-based approach to climate action. And I've tried to select a few that sort of address health, although it's so cross-cutting. So the top left, we have a picture of Sudan. These are solar systems for pumping water. And the implementation has helped these vulnerable communities and school children in the Blue Nile region, which is afflicted by conflict, to obtain water supply at a reduced cost without the need for fuel generators. So obviously environmentally much more sustainable. And the project has contributed to 20% increase in access to water supply. And the availability of the water has also helped to reduce the burden on women and girls in particular, who have to spend, increasing amounts of time to fetch water from further and further away. In the top right, this is UNICEF Burundi, who have implemented a project providing children with safe, clean, and low-cost lighting. This is Project Lumiere, which enables community groups to purchase these pedal-powered generator and fast-charging LED lights to sell within their community, and that's expanding the time for children to study, but also reducing their reliance on the use of kerosene and firewood candles, which are harmful to their health and also to their eyesight. Also, from a child protection lens, they're more able to go out at night if they need to go out and see what's out there, as they felt very unsafe before, so providing lighting for the community more widely as well. And finally, the bottom left, this is a UNICEF program in Bangladesh, which is delivering more fuel-efficient cook stoves to households, helping to cut emissions, but also the sort of smoky environments that Noah was describing, which are catastrophic for children's lungs. And also saving families money and time collecting wood. These stoves require less fuel, and in the process helping to reduce deforestation and to limit local flooding as well. So there's just a few examples. Thank you.
Thank you very much, Joni. I'm going to invite up next John O'Neill, Principal Officer on Climate Adaptation Policy. John is currently Principal Officer for Climate Adaptation Policy with the Department of Communications, Climate Action and Environment. John's current role within climate policy covers extensive climate adaptation policy areas that span national, EU and international agendas. These include implementation of the Climate Action and Low Carbon Development Act of 2015 and preparation of Ireland's first statutory national adaptation framework, review of the EU strategy on adaptation and next steps on implementing the Paris Agreement. Before joining the department, John spent over 10 years working in the private sector for various consultancies where he held senior management and supervisory positions on a broad range of projects. John. Okay. I'll just set this up now if we can. I was just thinking during Joni's presentation, one of the things that we felt maybe we made an error in the invitations on Eventbrite is that we talked about students and unwaged, but we never said senior citizens. And I'm wondering who, I don't know the answer to this, but I don't know who at an international level advocates for the rights of older persons. We have the child rights, but what about older persons? Okay. Great, thank you. Okay. Okay, yeah, thank you. No, that's all right. John.
Just the arrows, is it?
That's just the arrows. Oh, I see only blanks. Oh, there it is, yeah. Slideshow. It's a very fiddly process. Okay, thank you, John.
Thanks, Niall. Good morning, everybody. As Niall mentioned, I work within the Department of Communications, Climate Action and Environment, which has been pointed out several times to me, has the acronym of DECAY, which has obvious health implications. Hopefully not from a personal side of things. I think it's, as I say, thank Niall again, I suppose, for the invite. Because I think it's a very interesting idea of trying to get a national debate going or a conversation going in terms of climate change and health. We have, I suppose, conferences now in the last couple of years that deal with environment and well-being, and the agency do a lot of work in that area, the EPA. So it's good to I suppose look at this from that angle. I suppose I'm coming at it from the pure, I suppose, climate action policy side of things. So from the environmental side, but I think I hopefully will try and cover. I'm going to try and cover. I've got quite a few slides, but I know Niall is waving flags, so I'm going to try and move pretty fast, and hopefully I won't have any. I know Nick's diagrams, he thought they were bad. I've got a few as well that might cause problems, but just I suppose just set the context really is that we do know that there is an issue. And this is I suppose demonstrated by the fact that we've hit this 1 degree move in the last since in the start of the industrial times. And then we have this some people might have seen this before, but this is I suppose what is described as the 2 degree challenge, which has been referenced in terms of the Paris Agreement that we have from 2015. And this idea, I suppose, and this shows, it's quite complicated, but what it tries to show, I suppose, is different scenarios that we face, and where we might be heading in terms of temperature ranges that we will be moving towards if we don't do a certain amount of mitigation. And I suppose what we need to be doing is heading down towards the blue at the bottom, really, in terms of our targets. And even the Paris Agreement recognises going beyond the 2 degree to a 1.5, so trying to keep within that limit, which is a significant challenge. From the point of view of impacts, I suppose, and moving on to the health side of things in terms of where some of these things are, and maybe talking about what Nick referred to as the direct and indirect impacts. There's a lot of information out there. One of the sources that we would use is in relation to the European Environment Agency. And this talks about, I suppose, the extreme weather events. It talks about disease outbreaks, invasive species and so forth, and how this is going to impact within a European context. And also the heat waves and droughts and so forth as well. So it's stuff that we've been hearing about this morning from Nick and from Joni. Just picking up on a few of them, I mean, just from the environment side of things, but even something like ecosystems that we know, some of the trends that we're looking at the moment would show that species are actually migrating north, and certain species who are more warm adapted as opposed to cold adapted. Bird communities butterfly communities and so forth. These are might seem as minor issues, but actually they have knock-on effects in terms of overall ecosystem services, and particularly with agriculture and other areas. So it is very complex, and we don't really know how some of these interactions are going to happen in 5 or 10 years from now. But it's just something to note, that there could be I suppose, negative consequences, but there could also be positive consequences in terms of how this happens in certain jurisdictions. Another one that I suppose is has been looked at is in terms of forest fires throughout Europe, and I suppose we've seen that over the last number of months, what's happening, and in terms of crop yield. And I suppose in terms of forest fires, it's quite obvious what the climate impact is there, or sorry, the health impact. But also in terms of crop yield, and Nick touched on this as well, where you're maybe looking to think that where certain member states within the EU might have a benefit from the agricultural point of view in terms of crops, but other countries won't, and what pressure is that going to put on the import-export or import and export of grain, for example, from different countries, and what impact that has globally then in terms of food supply. So there are these I suppose overarching issues that we need to take into account. Flooding has been mentioned several times, and it's something that's quite obvious in our own case here in Ireland. And the EEA have attributed I suppose figures in relation to deaths from flooding over the period from 1980 to more recent times in 2010. And as you can see, there's quite an increase in over that period as extreme events become more frequent. This has been mentioned previously as well, and this is just to pick up on one of them as well in terms of the infectious diseases, and this is the West Nile fever, and just how that will move, or how it's projected to move in terms of 2050, irrespective, based on what was observed in 2014. So again, just showing how some of these, I suppose, diseases are actually moving without moving beyond their what we consider to be their normal borders. Just briefly to mention, I suppose, in terms of being from a policymaker's point of view, maybe that the EEA would actually put some numbers on this in terms of fatalities, but also in terms of economic losses and in terms of insured losses and so forth. So there's a sense of trying to put a value on this, and this raises the question, I suppose, for the health sector. Is there a positive or negative value that can be attributed to what I suppose the opportunities can be in terms of savings and so forth, but also what the impact on the health system itself is going to be. So these are I suppose a broad brush, a very quick dip into I suppose much broader issues as we would see it from the environmental side, but that which have a very strong relevance to the health side of things. And I just, from a personal point of view, I suppose one thing I've noted in my time in climate policy is this and it's been mentioned a couple of times, is the fear factor. And I suppose we often see, I suppose, cartoons like this, maybe stuff that in terms of climate change, which has obviously a health dimension to it. But then we would see other things like this, where you see the surf fan underwater, and or the house at the edge of the cliff, and things like this. And there is a a cartoon element to it to a certain degree. But there is that other element, I suppose, where we know, I suppose, something intense or bad could happen if we don't reach our targets in terms of what we're trying to do. And that's and this is down in Wall Street, a show of what might happen in New York, and something similar did happen in New York fairly recently, I suppose, with Hurricane Sandy. But I suppose a lot of this raises the question about how we deal with this anxiety, because this is something that's happening on a more global basis, but it's also happening here in terms of flood events and extreme events, and how communities who've who've experienced that and who think they're going to experience it again, on the West Coast. We've had it recently in Donegal as well, and the actual impact that these events have on local communities, on their businesses and so forth, and what is the actual mental health I suppose impact that's been caught there, or is it being captured at all? But there's a collective about this as well. It's not just an individual thing, because we're being told about this. We're looking down, I suppose, what the impacts might be, and does that bring a I suppose collective sense of anxiety of what the future might bring. In terms, but also I suppose kind of in terms of kind of local populations, and that was just a diagram I started with, which is kind of if anyone can recognise that, that's actually Enniscorthy, and that's the kind of the N11 that crosses over, going back to 2014. So just briefly to kind of, this has been mentioned, I'm not going to spend too much time on this. The UN response globally, we're all working towards the Paris Agreement, and as Nick mentioned, in a number of weeks, everyone sits down at COP23 in Bonn to continue that work under difficult circumstances, obviously. And then within the EU side of things, without getting into too much detail, kind of stuff like the EU family as such, if you want to call it that, has their own kind of targets to meet. There's kind of regulations there. We're all trying to kind of, I suppose, kind of work towards that in terms of, the burden share for each member state to try and kind of, I suppose, kind of mitigate and contribute to the Paris Agreement. And this year, or probably kind of more likely kind of next year, there'll be an agreement on that in terms of kind of what will be in place for the next decade from 2021 to 2030. So what are we doing on an Irish kind of level? Well, I suppose going back just 3 years, really, kind of we had our policy from 2014, which really kind of, I suppose, kind of gave us something to kind of hang the legislation onto. And this is kind of, this policy is guided by a long-term vision of low carbon, climate resilient transition. So it's kind of trying to mitigate and adapt, and that's kind of, I suppose, kind of the two sides of the same coin effectively, but it's trying to kind of, I suppose, kind of address those two issues. We have the Climate Action and Low Carbon Development Act from 2015, which really sets or puts in place a kind of an institutional framework to try and kind of deal with this, given that we haven't had this before, in terms of this is the first time Ireland has had climate change legislation. We have the Climate Change Advisory Council now, which is an independent body to advise government on kind of climate issues moving forward. And I'm not getting into the role of the Department of Foreign Affairs, but they have a huge role to play internationally in terms of Irish aid and so forth on the climate side. But I just wanted to focus really kind of on kind of the more kind of national, regional and kind of local picture. Just in terms of the legislation that we have kind of, I suppose, kind of on the mitigation side, we have the preparation of a national mitigation plan, the first of which was published back in July this year. So fairly recently, this is the first national mitigation plan that we've had. So it's a first step, effectively. We also, kind of more recently, kind of just this day last week, published a draft national adaptation framework, we have to kind of have a final framework in place by the end of this year. This public consultation is online, obviously, with our own website, and the consultation closes on the 27th of October. So it's open for the next 5 weeks or so. And as I said before, our final plan is due by the end of the year to go to government. And this plan sets out kind of tries to set the context for what is the role of the sectors in dealing with kind of adaptation, which is the main area I deal with, but also the local authorities in terms of that kind of local interaction on climate issues. And in that respect, obviously, we're going to hear from Ina after me on the health side. But it's I suppose kind of to somewhat kind of, and this is very simplistic, but it does give a kind of an overview of kind of all the different kind of parts that are feeding into this kind of particular framework that we're looking at on the climate side. And kind of, I suppose, kind of how we kind of are trying to kind of coordinate all the different kind of levels that we need to, that are relevant on the climate side. I want to mention the local authorities just for a moment, because I think the local authorities are going to play a very key role in terms of the local regional kind of interaction on climate. Not only in terms of the low carbon transition, but also in terms of kind of developing climate resilience at the local level, in terms of them being on the ground, the people who are kind of, I suppose, the first responders. I mean, we often hear about kind of, I suppose, kind of the extreme events, and then about 2 days later, it's out of the news, and everyone moves on. But for the people in those communities, it goes on for quite a bit longer, and the local authorities are very heavily involved in that work. I think kind of one of the key issues, and we're going to hear, I'll talk about this in a bit more detail later, but and Jonathan will be talking about this afternoon as well. But what role the local authorities will have in the awareness side of things, in kind of bringing, I suppose, kind of having that conversation or dialogue with the communities about kind of issues relating to climate change at the local level, which is going to be very important because, I mean, kind of, you know, we can sit up in Dublin and kind of sit down with the politicians and talk about climate policy, but if we're not actually kind of speaking to people at a local level as well, or a kind of regional level, it's very hard to actually kind of get actions implemented. So I think there's a very strong leadership role, which the local authorities kind of have very much embraced in terms of what they want to do, and they're looking at how they're going to develop a regional approach to climate, which is very encouraging for all sectors really kind of moving forward. Just to say, I suppose, kind of in terms of what's there for the local authorities, there's guidelines and so forth, but there also is, and I don't know if you can make this out, but there is a kind of a website called Climate Ireland, which is kind of, and you know, kind of if you Google that, you'll kind of, it comes up, but it's a kind of, it's a process where we're trying to kind of, suppose, kind of trying to kind of get as much climate information into one kind of national kind of web portal. And this is a kind of an ongoing kind of process where we're trying to develop this portal into something that's kind of maybe a kind of a one-stop shop for climate information within Ireland. It's been developed initially really for local authorities to kind of work through kind of a lot of issues for themselves and so forth, and how they might kind of take the steps in doing their own plans and strategies in terms of climate change. But it's definitely worth checking out in terms of the information that's there. It's very, very useful. Another issue which is really important on our side is the research side of things, and kind of, I suppose, kind of working with the EPA, but with other bodies as well and agencies, and with the third level side of things too, because kind of, I suppose, kind of a lot of the work that we do, we're kind of, you know, we often find gaps where we kind of need to fill kind of in terms of information and data. I mentioned Climate Ireland. We also have kind of projects that are looking at kind of climate futures for Ireland. We have adaptive responses to kind of climate impacts. We have kind of looking at critical infrastructure, how vulnerable is that to climate change within Ireland, and overall climate change risk assessment. And we have a very interesting project actually called Urb Adapt, which is kind of looking at kind of how the cities and towns of Ireland kind of actually kind of will kind of, I suppose, kind of have different impacts to the rural communities. So kind of when you kind of look at that, kind of, you know, kind of heat and kind of other issues come across quite different in terms of the urban environment as opposed to the rural side of things. And then we're also trying to look at kind of what will 2050 look like, because a lot of the time, and it's been mentioned earlier in terms of the kind of the short cycle that we have on the political system in terms of 3 to 5 years, or sometimes shorter in our case, kind of how do we kind of actually kind of engage people on what everything is going to look like in 2050? And this is really a difficult challenge, because a lot of people just, it's very hard to even kind of look 5 years down the line, even 10 years down the line. But to look, you know, kind of beyond 30 years down the line is a serious challenge for a lot of people, including our politicians, obviously. But it's trying to kind of envisage how that might look, and are those, I suppose, kind of, are they decisions that we have to make? Are those decisions that we have to make, let's say, is that palatable to everybody? Does everybody want to make those decisions? Are people happy to make those decisions? So there's a lot of issues that we need to look at. And I suppose kind of in terms of kind of not just on the climate action side of things, we do have kind of a lot of other, I suppose, kind of work going on that we need to coordinate with. And kind of within our own department, kind of there was a climate air quality strategy that went out for consultation recently. And this is kind of working with, I think the consultation on this is closed, but this is kind of looking at the areas that are very relevant to the National Mitigation Plan. So kind of looking at the residential side, transport, agriculture, energy, and industry. And it's trying to kind of, I suppose, kind of align what's happening on the climate side with what's happening on the air quality side. And obviously kind of, underlining, I suppose, a lot of the issues that Nick pointed out as well in terms of kind of, I suppose, the air quality and the health impacts, and how kind of, I suppose, we're kind of trying to kind of make sense of all this in a kind of a coherent national approach. I mean, the air pollution in Ireland, obviously kind of this is a very, I suppose, kind of there's a lot of information here, but just to kind of on the right-hand side, it's really just kind of showing that the same sectors obviously are kind of relevant in terms of the emission side of things. So it's kind of, I suppose, kind of just trying to focus in on that and actually kind of try and highlight what the actual health benefits are going to be in terms of kind of the actual mitigation actions that will be kind of brought forward. Somebody earlier mentioned the Sustainable Development Goals. This is something else that's been kind of, I suppose, moving at the international level and at the EU level, and from a national point of view as well. How do we kind kind of, I suppose, incorporate everything that we're doing with the clean air side of things and the climate side of things. How do we do that within the wider context of the SDGs? So just coming to the kind of end, I suppose, kind of very close to the end, it's how we get policy coherence. We have a national mitigation plan, we have an adaptation framework, we have sustainable development goals, a clean air strategy, a national planning framework, so we have a lot of different things coming out of government. And where does environment and well-being, how do we address the well-being side of things? How do we capture it in terms of having coherence with all these different initiatives ongoing? Just to mention briefly the dialogue, which was mentioned earlier, and this is something I suppose that's kind of, from our point of view, is really important, going back to that point about trying to kind of engage more kind of on a regional, local basis. And this is something that's in the programme for government. Obviously people do want to talk. I don't know if anyone recognises this, but it's very local. It's down at the docks here in Galway, and this was about 2 or 3 years ago. And if anyone can see that, but anyway, it's so there's a clear need to maybe for some people that want to talk about climate. So the national dialogue has been set up. It's just starting. It's about creating awareness and engagement, and it's about putting structures in place to try and do that. It was established by the Minister in July this year, and it's to make recommendations to the Minister and so forth. There's 16 members on the advisory group who are I suppose, trying to, in a sense, represent all of the diverse interests from different areas. There's already a very strong a programme in place in terms of the school side of things, because we're trying to focus an awful lot on the young people and how we can work with the schools on the climate action agenda, and there will be a Green Schools Climate Action Expo next year on this. And then just to note, not this weekend, but the following weekend, there'll be a citizens' assembly on climate. So this is I suppose, the next issue that they're going to take on. And this is going to happen on as I said, not this weekend, but the weekend after. And this is about really what are the challenges facing communities, to try and get a sense of what are the concerns. And how do we, and is health issues being picked up in that? I think will be one of the key things that we would be interested to hear. And what level of action can be taken, or is it best taken at the individual, the local, community, and so forth? How can that happen? And that's it. Thank you.
Thank you very much, John. I was just thinking while you were speaking, we'll hold questions till the panel session. We have one more speaker and then we'll have the questions. We'll have enough time for questions. I was just thinking about urban. I remember last year watching a video by a guy called Hans Rosling. Unfortunately, he's passed away last year. He was from Sweden. He was great at communicating. I think he called himself an edutainer, an educational entertainer. And he was talking about how most of the world's cities have yet to be built. And I think we have a massive challenge in terms of planning our future urban environments. Okay, our next speaker is Ina Kelly. Ina is a consultant in public health medicine, HSE Midlands, and chair of the HSE Public Health Medicine Environment and Health Group. Part of her work involves collaboration with the Department of Health and John's department, the Department of Communications, Climate Action and Environment, and other sectors towards a climate change adaptation plan in the health sector. So I invite Ina. Thank you, Ina. Are we still on the same version?
I think you have my presentation somewhere, don't you?
Yeah, I do have
Yeah,
it. Yeah.
thanks.
It's the same one, yeah.
Thank you.
Okay.
Yeah, I didn't change it. Well,
Okay.
for good or bad.
All right. Slideshow. There you go.
Okay.
20.
Well, thanks, Niall and Dermot and everybody for inviting us along to, or inviting me along to this. And obviously I represent a bigger group really of public health doctors who are involved in climate change work at the moment. And so I'll just move on with this. I suppose the things I'm going to talk about here they've been touched on pretty much by everybody else as well, but I feel that the thing that John hears enough from me anyways about interdependencies, because I suppose we're all coming from working in separate areas and is trying to communicate clearly our messages across to each other in all the other sectors, because we all have to influence each other and we have to try and learn from each other and help each other in a way to get to a better goal in the long run. I'll talk a little bit about it at international level, though I'm not very involved in that, but just what I see there. And then, of course, Ireland and what we're doing in Ireland. about climate change and health in Ireland, and some of the work that our Environment and Health group is doing at the moment, with contributions from even people outside of that and some of our other public health colleagues. And then some of the challenges and opportunities, I'll keep them brief, but actually I think they've been mentioned before. Climate change and health, when I was thinking about this, I was thinking, where does health fit in there? I mean, we obviously think it's really important because most of us are working in a health area and we value it a lot, but I just put in our health definition from the WHO from 1948, and it's still the main definition, really. Other people challenge it sometimes because they say it should be looked at from a different way, but it's a very, very encompassing, all-encompassing definition: physical, mental and social well-being, and not merely the absence of disease or infirmity. So it's something that is really important to everybody in the world, and no matter who they are. And I think that we know health is valued. I mean, Galway today here, we speak Irish sometimes down here, but anyway, it's fear an tlainse na tainse, which means health is better than wealth. And I think that's an international saying as well. And of course, prevention is the best cure. So these are very famous sort of phrases that are used, and they're sort of seen as truisms, I think. So I think we know that health is valued, but sometimes it doesn't get onto the agenda. Same as children don't get onto the agenda. Sometimes if we don't really push it, it doesn't be seen as being an issue. Obviously, our interdependencies are everywhere. These are not my slides. I took them from Google Images, and I can't really see who I can. I hope they'll forgive me anyway. Whoever drew them up, I think they're CDC and people like that. I'm sure they're happy enough with me putting up some of their images. But anyway, the interdependencies for climate change control, if we could ever get control over it, I know that's a very big challenge. They're obviously global, national and local, and of course the decisions that get made are made at local level, and as Nick talked about the political will, it's down to the elected representatives with their local populations telling them what they want, and that's very challenging, and yet the whole world depends upon all these local decisions being made. Mitigation obviously requires action at all levels and needs to be coordinated, and it needs to be comprehensive to be effective, and we all know that. Our health interdependencies, we obviously depend upon mitigation to limit these impacts. We can see them coming down the line. We can see them probably happening already. And, the health sector can't fix this. The health sector can contribute a little bit, but obviously we're depending on the whole global, management really on how we're going to affect change there. We depend on many other sectors, and many of the health impacts of climate change, they're outside of the control of the health sector or even the influence of the health sector. And so that's where maybe these interdependencies come in. We need to try and start communicating and sharing information. And even being understood, I think that might be something that we maybe aren't always understood as well as we think we are. We can have health impacts that could arise from other sectors' plans. Even the best laid plans may turn out to have unintended consequences or maladaptation. So we're going to have to be very clear communicators on how to achieve the best quality adaptation and mitigation as well. As John has mentioned about the Climate Action and Low Carbon Development Act, this is actually giving us a statutory framework for pushing forward, which is really helpful in a way because it, I suppose it's an iterative process. Nobody knows everything. We all have got to learn more, but having a statutory framework pushes us to try and achieve better and quicker, maybe. The National Mitigation Plan is already sort of being developed, and the adaptation framework as well is nearing finalisation. And these have required a lot of coordination and working together. And again, they may not be perfect. We may not have done all of the coordination and working together that's required, but it's getting there as well. And I suppose really we feel that health is likely to be impacted by other people's plans for mitigation and adaptation, but hopefully for the better. But we've got to make sure that that's the case as much as possible. Now, this is a really busy slide, as Nick mentioned. It's just my effort at really just locally mapping out the sort of climate impacts on the left-hand side, or the really weather impacts. With the middle ones are the environmental effects, like all the things that happen in Ireland, like our disrupted power supplies, communications, water supplies and so on, sanitation, flooding, unsafe roads, buildings and other infrastructure and so on. We can have loss of habitable land, drought. It can happen in Ireland even with precipitation issues that we have. Then the changed environmental fate of zoonotic pathogens and vectors. I mean, that's something that could have big game-changing effects, and yet, it's an area in which we need more science, really, I think. Same with the transport of those organisms that survive longer A lot of our assumptions in protection of human health through the environment are based on science that says like the die-off period of organisms and so on. Those things may be changing. And again, increased UV exposure opportunities. Well, most people in Ireland welcome that, but we still have to be careful about our skin because most of us aren't probably adapted for it. Indoor and outdoor temperatures, air quality issues, and respiratory allergens. They're the sorts of things that we're putting in. They're not all inclusive, but they're the sorts of things that we're thinking about at the moment. And I think I've broken it down into more detail there. Just again, I think some of the biggest issues there, I mean, the basic things like unmet basic human needs, including water, food, and shelter. And I know we see that more so maybe in countries that are struggling more with development. But those are things that are happening in Ireland too, and will happen perhaps more. And we depend so much for our healthcare on communications, power, water supplies, and so forth. We have emergency systems could be challenged, and of course mental health effects. John mentioned that. Are we measuring it? These are all challenges for us really at the moment. We can expect them to be significant for isolation, displacement, physical, emotional, and economic losses, stresses and losses. And physical injury, drowning, and infectious diseases are all the things that we're expecting. Again, the same thing here, and more, from rising sea level, changes in precipitation, warmer weather, and so on. We expect more challenges in Ireland as well. I mean, obviously, we expect a little bit decreased cold-related mortality. That could be one of the opportunities, but most of the things we're concerned about are worsening health issues. Now, our stakeholders include, obviously, other parts of the health sector. We have a massive health sector in Ireland with, we say, 100,000 or so workers, and most of us don't communicate with each other because we don't have that opportunity, really, or it isn't set up for understanding everybody's role completely. Department of Public Expenditure and Reform, the OPW, all of these within Ireland are important stakeholders: energy and communications, agriculture, environment, including the local authorities and EPA, transport, then the water services and sanitation as well. So far, our responses have been really working with the Department of Health and just, making ourselves more aware, really, of the policy and planning framework and trying to gear ourselves up so that we can start responding and providing what we need into health sector planning. Part of that is ensuring the health infrastructure is climate resilient. We've had issues in the past in which hospitals have been flooded and so forth, and you can't afford to have that sort of thing happening if we can avoid it. But of course, something that I'm becoming aware of is the dependencies. Our health infrastructure is, we know what our health infrastructure is most of the time, but our infrastructure can depend upon other people's infrastructure in the private sector or so forth. And so we have to be thinking about those dependencies as well, and who depends upon us too. Planning and preparing for severe weather, that has been happening in the HSE, and it's been quite comprehensive in lots of ways, and it's starting to mainstream, but obviously we need to keep pressure on those things to make sure that they are rolling out everywhere. And obviously our emergency response services and public health medicine and trauma, all of those, we all need to be geared up and ready for actions that might be required. Climate epidemiology, I think it's a new word, sort of, but I mean, it's obviously anyone who's working in this area will think of it as being an epidemiology that does need to be there. For anyone who doesn't know, epidemiology is really the study of the causes and distribution of diseases, and obviously we're trying to learn how to describe the diseases associated directly or indirectly with climate change or weather. And then, of course, health advocacy is an area in which we always need to be working in and trying to communicate with others about the issues that we have. Part of this that we've been doing is through bodies that we already have. The Faculty of Public Health Medicine asked us to deliver a paper on climate change adaptation and health. And so through that we produce some of the work that we have on that. These things are probably iterative again. We probably need to improve them as time goes on. We need to learn more about other sectors and how we can, make better recommendations. But so far, really, it's about doing what we're already doing in a way, developing climate policy and a strategy for the health sector, developing these plans. And I suppose something within public health particularly is we need to develop appropriate surveillance and investigation systems so that we understand our vulnerabilities better and be able to monitor health associated with that. And that paper has been endorsed by the Royal College of Physicians of Ireland. But again, I'm sure it needs to be looked at and kept up to date as well. Another one we did was in relation to the Citizens' Assembly. We developed a paper for really just, I suppose, a brief paper just to say, look, health, make sure health is on the agenda here. And we gave a summary of some of the issues that we see. I have to thank Matt Robinson, who really gave us a spur for that. He's one of our specialist registrars in public health medicine. And it was, again, it's an area in which we probably need to improve our position on this, but it does capture some of the points, really, that Ireland has a lot of work to do in relation to mitigation. And we have some data from the EPA on main emission sources. And reducing greenhouse gas emissions may be challenging, we feel, but there are numerous health co-benefits if we could tackle this as soon as possible. But of course, from a health point of view, we need to also make sure that the transition policies are acceptable to people, that they protect the health and well-being of the people in sectors affected, because you can't really have intolerable burdens. So they need to be incentivised and supported, and we need to understand what the challenges are for everybody who has to bear burdens. Like, for instance, I mean, we would obviously like the agricultural sector to go more from animal-based to plant-based in order to reduce emissions. And they're not just air quality emissions and climate, or greenhouse gases, but also environmental microbiological contamination is associated probably with some of the animal-based agriculture as well. And with our hydrogeological groundwater vulnerability in Ireland and increased rainfall that we're expecting, that's going to be something that's going to be harder to manage. So these are things that we'd like to put on the agenda really as well. Same with in the transport sector. Obviously, we're recommending that we move from passive transport, to more active travel, encouraging, which will obviously improve both air pollution, or reducing air pollution, but also have massive human health benefits from reducing obesity, increasing, fitness and so forth, and helping to control a lot of the chronic diseases that we have at the moment. And obviously, improvements in that area will reduce the burden of chronic diseases on the health services that are very overstretched. In the energy, residential and manufacturing sectors, obviously we're again looking for them to go from more carbon heavy to carbon lighter energy sources and so on. And we feel that we can get more significant benefits of that. Now in the health sector, the WHO has produced advice on that, and they've got about 10 different actions in which we feel that those sorts of actions within the health sector need to be pushed as well. And I think you can all read, well, I don't know if you can read that or not, but really, they're pretty obvious, like managing our own waste and hazardous chemicals, promoting efficient management of resources and sustainable procurement, and reducing our own emissions of greenhouse gases and pollutants. Prioritising disease prevention, health promotion and public health services is it's very cost effective, as well as probably increasing sustainability. Engaging the health workforce, we have a huge health workforce as agents of sustainability is very important as well, and that's an area probably we can keep working on. Increasing community resilience and promoting our local assets and creating incentive for change. Some of those areas are areas in which probably we need to be doing more in the health sector, but we have a guidance out there which is probably beneficial for us to use. We feel we have lots of potential health co-benefits. It's already mentioned, all these decreased respiratory disease, diarrheal diseases, obesity, cardiovascular disease, diabetes, cancers, and complications of all of these, and then the pressure on services. And we feel the case for mitigation isn't just about, getting fined by Europe or whatever, or just a Paris Agreement. It's actually, we feel that there are health grounds that we need to be pushing for, people recognising the fact that this is not, we can't go on like this on health grounds as well. But we do want people, I feel anyway, and I think personally feel, but I think most of my colleagues would feel the same as well, that we need to protect the well-being of the people in the sectors affected. We need to look after them as well. So we need to incentivise and support them and not put intolerable burdens, because of course they will affect people's mental health as well if they're not able to manage. So the challenges are really balancing all these interdependencies, and we can't work alone. We do work currently in silos more so, though we all have sectoral focuses, and health is not necessarily a priority for other sectors. So it's trying to get that health onto other sectors' agendas is important for us anyway. Of course, we need other people to see the benefits of health from their sectors. And I'm not sure that I haven't seen anybody really mentioning that a healthy workforce and a healthy population is in everybody's interest. Climate epidemiology is an area in which we have a big challenge because a lot of our data, health data, isn't collected with any weather variables. Few diagnoses are associated with a direct weather cause like sunstroke or whatever. A lot of them they've got multiple attributions. And so far it hasn't been identified as a priority. But I think it's very important though, because the lack of climate epidemiology information may result in costly maladaptation. If we haven't got the health data to provide to the other sectors, we may end up allowing them to make mistakes almost with the use of resources. So it's important that we try and get ourselves geared up as well, especially for big funding into the future. But the opportunities, again, are the same as really the challenges in some ways. We have these interdependencies and we all rely on each other. So this is my last slide, actually. Anyway, we all rely on each other. So it's a real opportunity for us. We have to communicate with each other. We have to influence each other. For us to be successful, we can't operate in silos anymore. We've got to work with each other. It might take a bit of a while before we all start speaking in the same language and speaking about the same things and all recognising that each other's goals are our goals as well. If as long as we're all going for the same thing, the political decision making, I'm not sure. I think that's something, again, maybe we all need to persuade our politicians to try and aim for common goals. There's an opportunity, I think, to design out inequalities. There's such a fundamental change in lots of areas in society that perhaps we have opportunities to go back and redesign some of the way we do things to not be just changing by increments, but actually, make bigger changes and design in safer, fairer, better health and societal systems. And maybe design out wasteful activities, understand where the waste is coming from. Maybe we try to just design it out better. I think a lot of there were good examples of those already today, but it's everywhere we operate. And integrated planning is required in every way, I think, mitigation and adaptation. And something that health sector always wants is health in all policies. And I feel it's the first time I've felt really in working in public health that actually there is an opportunity for us to influence health in all policies because I think we are seen as a sector there that has to be incorporated, and so it's up to us in a way to try and provide that, or in the health sector to try and provide the information required to help the other sectors to take on board the health issues as well. And that's it. Thank you.
Thank you very much, Ina. Can I ask each of the speakers to come back up to the top table, and we'll have a few minutes for questions. We won't spend too long. We do want to make sure that we give you the opportunity to have that space to network and to dialogue as individuals over lunch. Dermot, can you maybe give us a few minutes, a couple of seconds about the afternoon? Do you want to do it now? Can you do it now, maybe? Okay. Do you want to come over here? Sorry, yeah. Sorry, I'm springing it on him. You were probably expecting it after.
I thought I'd say it at the end. Hopefully we'll get people, the afternoon we have to move across the road because there isn't a room big enough to take everybody to break into small groups for a discussion about what next steps would be and what might happen. So the first presentation of the afternoon is from Jonathan Derham from the Environmental Protection Agency, who's going to tell us more about the national dialogue on climate action. So what we're going to do is discuss how we might engage in that and what the global, national, local actions around that might be, and try and feed into the national dialogue in some way. So the lunch is going to be outside here from the Sail Cafe, which you've seen already. There's going to be a table with plant-based food and a separate table for non-plant-based food, but there's not going to be any meat. It includes plant milks. So the afternoon then, as I said, we need people to be across the road by 1:30. So we do need to try to, it's a 5-minute walk, but by the time people leave here, walk over, and if it's raining, there may be a bit of a delay. So we will try and move things along. Okay.
Yes. Thank you, Dermot. So about 15 minutes for questions. If you can keep them short, if you can. Introduce yourself, where you're coming from, and the quick questions. So I'll start over here, then yourself, and then yourself. So we'll do those three first. Thanks. Yeah, Una, yeah.
quick. My name's Una Murray, and I work as an international consultant with the different UN agencies, but also I teach on the MSc in Climate Change, Agriculture and Food Security in the university here. But I really enjoyed the talks this morning. They were really excellent. And one sort of thread that I saw through the talks was this idea of coherence across different sectors. And I was kind of thinking, like, how can all development have some sort of climate proofing and health proofing? So I was wondering if members of the panel could talk a little bit more about how to actually get the coherence. I know it's important, and all of you mentioned that, but how can we actually get, I was thinking of lots of examples, particularly at the local level where the planning sector is so important. Like, new swimming pools are built outside a town, which means you have to drive to do your exercise as opposed, but how can you actually get this sort of proofing in local authorities? I think that's my question. Thank you.
Yeah. So if you want to answer that one first while we pass the microphone. Oh, no, sorry, go on, ask the second question.
Okay, thank you. I'm Pauline O'Reilly. I'm the chair of the Women's Network in the Green Party, and I'm a new representative of the Green Party for Galway. And I guess what I wanted to ask was if we think that we'd see any different political outcomes if the 500,000 or so children could vote in the country, because it seems to me, certainly from speaking to the Children's Rights Alliance and in Northern Ireland, that children had a very strong emotions following the Brexit referendum, because it really affects their futures more than anyone else's. Thank you.
And we have the other person here. Get the microphone down here.
This is more for John, really, and the government and the department. And I'd hope that we don't come away from today greenwashing the issue. And I'm wondering how he can justify the continued subsidisation of fossil fuels in our power plants, Eden Dairy and the peat-based, and also why we would even countenance building biomass plants when your sister department in the UK put the stake through the heart of biomass in a paper by Mackay and Stevenson in 2014.
Okay, thank you. Who wants to answer?
I have a very loud voice now. I can maybe have an attempt at not answering the first question. How's that? The sort of question about ensuring coherence, either in terms of how you see health sort of integrated throughout all of the different aspects of the response to climate change, or vice versa, how you see climate change integrated throughout all of sort of society and all of the different interventions, is a particularly challenging one, and I think almost, and certainly not a unique challenge to climate change or to public health. That sort of coherence and breaking out of those silos and ensuring sort of joined up governance seems to be a central challenge for a whole range of issues as we move on to sort of more complex challenges that we face today, certainly more complex than we were facing a century ago. The first, one example I've seen that I have been quite impressed with in the United Kingdom, and I'm impressed with it by comparison to what I see in Australia or around the rest of the world, and I don't know a huge amount about Ireland's governance here, but it seems that perhaps there's a similar setup, is the UK's Climate Change Committee, which is sort of a statutory independent body set up to advise, prod, poke the government across all of its different ranges and try and coordinate a response. It obviously, by itself, can't be expected to provide the sort of response, that we see. And so when the UK doesn't necessarily accelerate as fast as you would want them to, it's not the Climate Change Committee's fault, but it does do a very valiant effort at coordinating a whole range of different parts of government. I look at the CCC as something within the UK as if there's one part of government that we can always support and always try and lend weight to, I think there's sort of a lot of value to be had there. I don't know, Joni, if you sort of looking at the CCC have a similar.
I wasn't going to talk specifically about the CCC, although I do think you're correct on that. But from my perspective, I think a key point of policy coherence is really capacity building, actually, internally. Because if you're going to bridge the gaps, I mean, we've got the Paris Agreement, the SDGs, that are sort of showing clear links between these agendas. and it needs to lead to institutional change in the way that government departments are set up and the way they work. So from our perspective as UNICEF, again, we would call for child rights impact assessments, for example, on decisions affecting children. Now, traditionally, that's always seen in a very kind of narrow sense, but we would argue, well, if you're talking about fracking, if you're talking about other decisions that are contributing to climate change, then there also needs to be child rights impact assessments, and that will, again, bring in sort of expertise of child rights experts to these issues which aren't traditionally seen in that light. I have got another answer to the second question, but I don't know if...
Yeah, go ahead, yeah.
Okay. The other question was on the children's vote, which obviously an issue close to my own heart. Children do feel very passionately about these issues, obviously, and you know, we heard about 2050 and how difficult it is to galvanise adults to think about those issues. But actually, in 2050, a child born today, and you know, someone that's 6 months pregnant, this is certainly in my mind, will be in their early 30s. So we're really talking about the lifespan of sort of future generations who are being born every day. The problem is that children aren't being consulted, and when we talk about children, we're talking about under 18. So, you know, there are plenty of adolescents who are very well able to articulate their views, but even younger children as well, and who can go out and act as powerful agents of change. And that's why when I was talking about rights holders, it really is seeing them as individuals that have a voice and have something to lend, and they have a huge amount of creativity and passion to provide to this debate, and unique perspectives as well. You know, something that adults don't always see the things in the same light as they do. And I think key to that is education, making sure that they have the skills to adapt to the sort of future impacts, but also to adopt a very environmentally sustainable lifestyle themselves, because they'll be the ones that will shoulder the burden. And actually, just to add, I was at a meeting recently where someone said that many of the arguments being used against lowering the voting age were those that were previously used to stop women getting the vote. So I think that's something we should definitely revisit.
Okay, Richard. I talk about the proofing, the health proofing in a way, policy, and I suppose that's again that I just feel that climate change, the Climate Action Low Carbon Development Act did set up the Climate Change Advisory Council in Ireland, so we do have an independent body that does advise government, and John knows more about this than I do, but I'll just mention it anyway. And they are prodding and poking and pushing for everybody to start getting planning. And that planning is integrated, isn't it, John? I think that you can say that we are being pushed to work closer together. Getting everything proofed requires really that you understand that everybody understands everything almost in a way, and that's where the iterative development is going to be. It's going to take us all a long time to understand other people's policies, to recognise, oh, that's where that's going to affect us badly or whatever. None of us have all the time in the world, and unfortunately most people probably don't have enough protected time to spend on this yet, but that's where more resources coming in, and we'll get more and more opportunities probably to have a more thorough analysis of each other's policies and how they affect each other. So it's a developing area, I feel, and that I think that it's something that probably we need to keep looking for, and we need to keep recognising when we have it that it's a good thing, and keep working towards improving it. And again, yes, I think with children, I suppose that's something that, I suppose in public health medicine we think of all vulnerable groups, and children, vulnerable adults, vulnerable groups, but in reality perhaps we just often just call them vulnerable groups, and maybe not necessarily haven't got to the level yet of being able to tease out the particular groups that particularly need to be looked after in specific areas, because we haven't got to that stage yet, but it's something that we need to formally do, I think. All right. Pass to John then.
Yeah, thanks, Ina. Just to kind of come back on the coherence one. I mean, I went through very quickly on the kind of slide, but that was a kind of a key focus for us, because it's, there's so much going on in different areas, and and a lot of good work being done in different areas, and that are all have overlap in terms of kind of maybe trying to achieve the similar objectives or similar goals. And I think probably kind of over the last few years there's been quite a bit of progress made in trying to kind of coordinate that. There's still a long way to go. There's no question about that. But I think if you take 3 years ago and you take kind of what's happening today, and you have a kind of a conversation around the cabinet where kind of climate change has been mentioned within the same conversation as the planning framework, within the same conversation as our kind of national investment plan for the next 10 years. Kind of that wasn't there 3 or 4 years ago. So there is that kind of sense of kind of, well, how do we, and in fact, to use that term, climate proofing, how do we kind of climate proof? Because there is a sense that, you know, in terms of what we're talking about, it's a transformational change. It's not, you know, kind of a something, you know, kind of that's a kind of a couple of changes here and there. So there is a kind of a sense, how do you start this transformational change, and how long does it take, and how do you monitor it, and so forth. So from that point of view, I think we're doing our best to try and kind of coordinate this. It's kind of it's a very difficult exercise, because what you don't want to do is have 28 subcommittees trying to kind of organise certain things, and you just get caught up and you just never get anything done. I think the role of the local authorities, as I mentioned, is going to be key as well, because kind of, I suppose, kind of they are going to have a really kind of a key leadership role at the regional level and at the local level, in terms of, I suppose, kind of working with communities, but also kind of demonstrating what they're doing within their own kind of local areas, not just on the planning side, but in other areas too. And I suppose trying to build up capacity is an issue, but we're trying to help with that with the local authorities. But we would see them as kind of, when they have a regional approach up and running, that's going to help that a lot. Just mentioned the Climate Change Advisory Council, yeah, just to kind of remind you, and I'll be up in front of them next week myself, so yeah, so I'll be getting prodded and other things maybe kind of next week. But it is good to have that there, because they do kind of ask difficult questions and try and push. Pauline mentioned the kind of the on the children's rights side of things, and actually, thankfully, from our point of view, our minister has a very keen interest in the kind of the children's side of things, in terms of education and the awareness side. And I mentioned this kind of green schools kind of project that we run in conjunction with An Taisce. And it's a kind of a big enough program really to kind of try and, as I said, kind of bring climate ambassadors within all this kind of from schools from all around the country, and to bring that kind of voice into the local community. So it's trying to hear the voice more than kind of, I suppose, or give a space for the kind of I suppose the kids in the school at different levels within the kind of secondary school and primary school, to have a voice of what they think the issues are or how they see it, which isn't there at the moment. So it's kind of it's trying to maybe kind of open up that door. I think probably in that respect, maybe the parent department of education will have a role as well in the long term. And then maybe kind of just on the question of the subsidisation, I think it goes back actually to policy coherence to some degree. But I think the key question here is the kind of stuff that is to take the context. In terms of our national mitigation plan, which was just published in July, this is kind of the first kind of national mitigation plan kind of done in Ireland. Previous to that, it was kind of a sectoral by sectoral approach. It wasn't necessarily kind of coordinated, kind of in a whole of government approach of how we did that. So the aim was to try and kind of do that within a coordinated way, to get all the sectors, well, the key 4 sectors, kind of into one plan, let's say, and kind of move forward. It's very much a first step. So there is a kind of a transition, I mentioned transformation earlier, but there's a transition phase to that. So we can't change overnight in terms of what's existing. We have to go through kind of certain changes in terms of kind of how we actually kind of I suppose make the transformation and phase certain things in and out. There's also a social and economic kind of side to this as well, in terms of kind of current jobs that have to be phased out as well. So that issue needs to be addressed. And I think the biomass issue in terms of the overall coherence, I didn't put the kind of all the different covers of all the different plans and programs that are out there. But I mean, the bioenergy plan, for example, and kind of that's been done within our own department as well. Kind of we need to look kind of how that is coherent with everything else as well, because there are air quality issues to it. I am aware of it, yeah, but I haven't read it yet. Yeah.
I think you should read it. The life cycle analysis of biomass is worse than coal. And the ESB are proposing to put in plants in money points. That's the only one being put forward at the moment. The single biggest CO2 emitter in the UK is Drax, which is their biomass plant that we're modelling our plans on. So I think we need to be careful about what we're planning.
Yeah, no, look, I mean, I'm sure the energy people in our department are kind of looking into this, and kind of, I mean, I can talk to them about it for sure, but that's, again, coordinating, I suppose, kind of through the sectors to make sure, I mean, at the end of the day, what you really want to have is a kind of a coordinated, coherent plan, and you don't want to have something that's going to impact on something else in an unintended consequence, let's say. So, I mean, that's what we're trying to do. Whereas previously, I think that might have happened in certain sectors where they kind of crossed over. So this is it's a first step. And I think kind of we need to recognize that we've come a long way, but we've an awful long way to go. Yeah.
Okay, thank you. I'm just going to allow just 2 more questions. I've already spotted the 2, sorry. There will be an opportunity in the afternoon to discuss a lot of these issues, okay? So please don't feel too excluded by the fact that we've only got an opportunity for 2 more. Yourself and yourself at the back, yeah. And give that count. Yeah.
I'm sure my voice is big enough anyway. But, Derek Hamilton's my name. I'm Antashka in Galway. I have to thank John for his reference to Antashka there and the Green Schools. It's one of the big things that we're very, very proud of as an organisation, that our staff get into the schools and at a very young age. But I have to bring things back to a local level here in Galway and the issues of planning. And he is confident that local authorities can lead the way. I have to disavow that actually, because I'm a member of the planning SPC in Galway City Council, and we have issues here, obviously, over the last 20 years with the way we're planning at a very slow rate for the development of roads and motorways. That's one issue. But we're all consumers, and that's the second issue really that we haven't really discussed. 85% of what we eat is imported, and that's an issue because most of it comes on the roads and is delivered to our supermarkets in the big trucks overnight from the UK and from elsewhere. So this whole idea that people living in cities are dependent on shopping centres. We have about 18 of them in Galway, in the city, and there's proposal now to build another massive one in the centre of the town. We've already overshopped, if you like. So it's this whole idea that we're consumers, and by consumers we're creating the problems globally with carbon emissions. So it's just to make that point. That
okay.
Planning is a really big issue. The national planning framework is so important, and politics and politicians, I know from my own experience, they're very, very slow, and they're quick to jump on the good news stories, like a new shopping centre. It's marvellous, you know,
okay.
But they don't look at the other side of it.
Yeah.
So
thank you.
just the point.
Yeah, thank you very much. We have a microphone there already, yeah.
Thank you.
Yeah.
My name is Anne Donlan, and I'm from Glower, which is a local age action advocacy group, and we have a number of our compatriots here today. There's been quite a lot of talk about vulnerable groups, and obviously older persons would be considered a vulnerable group in terms of heat waves, drought, flooding, and that's it. Yeah, sorry. Can't think of the third one. However, I think it's important that we look at older persons as leaders, as people who have wisdom and indeed humility around. They've lived, they've seen it all. And I've seen several groups who are in 55 and over, who are involved in the Green Sod, for instance, the Mercy Order, very, very acutely connected to saving Mother Earth for those that are coming behind us. And I'm hoping that in John's expert group there, that there might be some older person's voice represented, because they are a key as well, lest it be thought that they're going to expire and don't care about the world. I think they're a bank that we should never forget in any discourse around health. And I liked where Joni mentioned intergenerational equity. I know yours was in connection to the rights of the children. As I said before, there isn't actually a convention there on the rights of older persons. But we do have that elders group at the UN that Mary Robinson has been keenly involved in, founding, and also Nelson Mandela had a role in it when it started. And the whole developing world, how important their elders are in terms of the way forward and providing leadership. So I think that's a very important part of climate change and climate justice. And thank you.
Thank you very much. I'm going to call a halt there. Clearly there's a lot of passion in the room, and it's really fantastic to see. I'm just going to finish by thanking all of our speakers and thanking you also for coming and participating so well and so strongly. And I invite you to make sure that you come in the afternoon, because I'm sure there'll be a lot more to discuss. So thank you very much.
I should have said, for people who don't know where the Westwood Hotel is, after you've had your lunch, go out the gate, turn right. At the traffic lights, it's the hotel diagonally opposite you. So there's 2 pedestrian crossings, and it's in that room. When you go into the hotel, the door is on the part of the building closest to us. When you go in, go straight ahead through the double doors ahead of you, and we're in the second door on the right. The signs anyway. The food is outside the door, just out here, and if you can eat here before crossing the road. Very good.